Hi, my name is Essence Pittman, and I will be working with Bernadette Jackson today to insert a urinary catheter.
Come in.
Okay. Hi, Ms. Bernadette. My name is Nurse Essence, and I'll be here from 3 to 7. And right now, I'll be in your room roughly from 15 to 20 minutes. I'm here to insert your urinary catheter for you, okay? Alright, but first I want to look at your surrounding environment. I want to make sure that your bed is locked. It is at the lowest position, that your area is clutter free. Your call light is present here, I see. And your bedside table is here and your 3 side rails are up. Do you mind verifying your name for me?
Bernadette Jackson,
Okay, and how old are you?
85.
Okay, do you have any known allergies, Miss Bernadette?
No, ma'am, just a couple of seasonal allergies.
Okay, and your MRN number is 7753214. 7753214. Okay, so you are exactly who this chart says you are. And so today, like I said, we will be inserting your urinary catheter. Do you know what that is?
No, ma'am, I don't.
Okay, so a catheter is just basically a tube that we insert into your urethra. Your urethra is the organ in a part of your urinary system that pushes out all of your urine. But right now, you have been retaining a lot of urine, so to make sure that you don't have any type of bacteria or infection going on around in there, we want to make sure that we insert this catheter to get all that urine flowing out of you.
Okay.
Do you have any questions?
No, ma'am.
Okay, great. So first I'm going to raise the bed up to working position. Okay. Alrighty, are you comfortable?
Yes,
Okay, I
ma'am.
just want to make sure I place you in a comfortable position. Okay, so first, before I do anything, I'm going to make sure that I palpate your abdomen to look for any type of distension. So I'm just going to expose your stomach a little bit. Okay, so I'm palpating your abdomen for any type of distension or bladder thingies. So are you feeling any type of discomfort when I touch your stomach?
Just a little.
Oh my gosh. Okay, so yeah, that bladder is just a little bit. Okay, so now I'm about to get started. We see that you have a lot of urine backed up in you. So first, let me clean around your perineal area. Okay, so first let me wash my hands. And I'm gonna gather my gloves, 3 towels, and a water basin. Okay. So, I have some water here. Miss Bernadette, do you mind feeling the water to see if it's too hot or too cold?
It feels just fine.
Okay, thanks. That's great. Okay, so now I will be washing your perineum. So let me pull the cover. Let me pull the cover back a little bit, and I'm going to expose your bottom half. Let me cover your top half. Okay, so I'm gonna move your legs in the recombinant, dorsal recombinant position, so I can get. Okay, so I do have a waterproof padding up under you just in case we get you a little wet. Alrighty, so let me bring this over here. Okay, first I'm gonna start by washing you. Put a little stuff up here. Okay. I'm going to wash you from left to right, okay? So I'm going to wash your left side, fold the towel, wipe your right side, fold the towel, and I'm going to wipe down the middle. But I do see that your urinary meatus is intact. Everything is pretty good down here. There's no type of redness, rashes, or any displacement. And I'm going to rinse towel to rinse off your perineum. Fold the towel, fold it, wipe down the middle. Okay, so now I'm going to get ready to dry you. Left side, right side, and down the middle. Okay. So now that we are done with that, I am going to discard of the towel, and if they're appropriate, then I'm gonna rinse out the basin. Discard of that, and now I'm gonna wash my hands. So now I'm washing my hands. Okay, now I'm about to get ready to set up your catheter. So first, let me open your legs into a recombinant position again. Make sure everything is good here. So now let me gather my things. Okay, so now I'm just gonna keep this in my pocket for any type of documentation. All right, now I'm gonna peel back the thing to make sure I'm doing it sterilely. Now I'm gonna get my gloves. And I'm gonna put them on with the correct sterile technique. Equipment that I need, and now I'm going to place this padding shiny side down over you, under you, and now I'm going to put this this thingy right here over you, covering your any excess body parts, and I'm just gonna leave your opening where your urethra is, and I'm gonna move this closer. So now what I'm doing is open up the lubricant to place on the tray. I'm gonna open up the swabs from the bottom end, and I'm gonna place them here. And so now I have your catheter, and I'm going to hold it. Okay, and I'm going to lubricate the tip of the catheter. Okay, I'm trying to get it really good so it doesn't hurt while I insert it. Okay. So now I'm going to wipe down your labia from the left side, right side, okay, down the middle. Okay, now take a deep breath for me. Inhale. I'm gonna hold your labia. I'm gonna hold your labia. First, well, before I do that, let me hold this. I'm gonna cap my syringe, my pre-filled syringe. I'm gonna cap it. And now, since I have lubricated the catheter, I want you to take a deep breath for me while I insert the catheter. And I'm gonna hold your labia, and I'm gonna insert. Inhale. Okay. Oh, everything is great. I see a little bit of urine. So now I'm going to push just a little bit more. I'm going to insert 4 milliliters of water to balloon it up. Now I'm going to pull to see if I have a little resistance, which I do. Now I'm going to push just slightly. Okay. Now let me hold it. Okay, everything is good. Okay. place that there. I'm going to attach the catheter to the side of your leg right here. And I'm gonna hold the drainage bag. And I'm gonna clamp it on your side. So let me now get rid of all of this mess around you. All of this away. Throw this away. I'm going to take off my gloves. Wash my hands. Okay, everything is good. Miss Bernadette, do you feel any type of discomfort? It is known to feel a little bit discomfort, but now I'm gonna close you up. Okay, so are you pretty good? Everything is fine? Great. All right, now I'm about to lower the bed to the safest position. Your bed is locked. Your call light is right here. All 3 side rails are up. There's no clutter around the floor. Your bedside table is right here. And you are great to go. So do you have any questions for me? Okay, so since you don't have any questions, I'm going to leave you now, but don't hesitate to call me on the call light if there's any problems, okay? Alrighty, thank you.